Hi friends. So today we'll look a little more into gallbladder cancers and bile duct cancers. Gallbladder cancer is very much India's cancer. It's one of the cancers which is it's probably the highest incidence in India as compared to a lot of parts of the world. So we have a much larger experience as compared to most centers across the world when it comes to gallbladder cancers. It is a disease with where most patients present unfortunately at a late stage, and very few treatment options are they are amenable to at that point. But it is important to understand that gallbladder cancers, the only treatment or the only chance that a lot of these patients have is with radical surgery, is with aggressive surgery. And that is what we've been doing over the last decade and a half. And we've learned a few lessons from that. So we've seen that often we've seen patients coming to us after a laparoscopic cholecystectomy with a report showing a gallbladder cancer in the gallbladder which has been removed. Now, a lot of these cancers could be picked up on with better imaging before the laparoscopic cholecystectomy. Of course, a lot of gallbladder cancers do present in the background of gallstones, which makes the entire scenario more difficult to pick up. Early gallbladder cancer or incidental gallbladder cancer is a common presentation that we see in such patients. And many of them will do well with what is known as a revision surgery, because just removal of the gallbladder is not enough. We need to get out a wedge of the liver along with the lymph nodes. Sometimes we need to revise the cystic duct which joins the gallbladder to the bile duct, and check on a frozen section whether that is also showing signs of the cancer. And if it does, then we need to revise it. We may need to remove a section of the bile duct to complete the surgery. So that is a revision surgery for incidental gallbladder cancer. There's the other subset of patients who will present with a tumor in the gallbladder, sometimes just going into the liver, sometimes with lymph nodes, sometimes with jaundice. The treatment again has to be individualized for these patients. A PET scan is a very, very good investigation. In combination with a triphasic CT scan, we are able to identify the exact pattern of spread of the disease. Many patients will present with disease which is spread, in which case not much can be done except for palliative stenting and chemotherapy. But locally, disease which just locally involves the liver is still amenable to a radical surgery, and many patients do well once treated aggressively. So that is why, again, like in some of the other cancers, it's a team that routinely treats these cancers, which can give you better and better outcomes. We've had mixed success with aggressive major hepatectomies or major liver resections for gallbladder cancers, and we found that patients who are node negative or don't have too many large lymph nodes tend to do better with aggressive surgery as compared to those with very, very large lymph nodes. I think those are the patients which tend to do badly. Chemotherapy and radiation can be given before the surgery in such cases, in bulky or locally advanced cases, to try and select out patients who respond well to these treatments, may do better with surgery. Bile duct cancers, on the other hand, need aggressive surgery. Often these patients present with jaundice. We do what is known as a PTBD or an ERCP to try and reduce the jaundice. It's a tube which is placed in the bile duct to try and reduce the jaundice. And once the jaundice is lesser, we go ahead with aggressive surgery. Many patients with bile duct cancers will require either removal of the right or the left lobe of liver, along with what is known as a segment 1 or a caudate lobe. So it is a challenging surgery for a liver surgeon as well, but it's a cancer which has better outcomes than the gallbladder cancers if treated well and treated correctly. Not too many teams or surgeons do aggressive jobs or aggressive surgeries for these cancers, and I think that's why it sometimes is thought of as a cancer with poorer outcomes. But overall, we found that biliary cancers or bile duct cancers do much better than gallbladder cancers if treated correctly and treated well. Uh, Complete lymph node clearance, just like all other cancers, is very important. So complete portal lymphadenectomy is important. And often the small bile ducts have to get joined meticulously with a loop of intestine called the hepatic or jejunostomy. So it is a complex, long 6, 7, 8 hour surgery sometimes, but sometimes we also have to resect a segment of the vein and join it back. So it is sometimes, these are long surgeries, but when done well, are very, very satisfying. And we've got a set of patients who are long-term survivors, and it's very heartening to see them. Um, the role of chemotherapy is a little limited as far as biliary cancers are concerned, uh, but there is a lot of evolving evidence, especially in node positive patients. And like most other cancers, both gallbladder and bile duct cancers need multimodality treatment, and every decade we are getting better at treating these cancers, and the outcomes are improving, and a lot of patients do survive for a long time. Feel free to contact us, look at our website for further details. We'll be happy to help you. Thank you.